Let's talk about congenital deformities. After knowing about talipes, TEV, you will stop this attitude of when you see somebody, the mama no drink medicine, the mama did not take folic acid, the mama no drink calcium. We have this congenital deformity called TEV, otherwise known as club foot. The picture will be attached to the screen. I will attach the picture to the screen. That's if I see you. If I don't see, I will demonstrate what I'm talking about. But I know some people knows what I'm talking about already. I know some people knows about what I'm talking about. So talipes, TEV is a congenital deformity of the foot where the foot is twisted out of its normal position. You know how our foot is. I cannot even stand up to explain it. Our foot is supposed to be like this and is now twisted as in inwardly like this, downward, inward, and rotated. I don't know if you understand. So that is what it is. That's what talipes is. Sometimes people with this talipes, when you see their calf looks tinier. It looks tinier. Sometimes this deformity doesn't have an unknown cause. No doctor, nobody fit tell you, except say you can call God to come and tell you why it happened. This one is not that the mother did not take prenatal care, that's why it happened and all that. No. Sometimes there is no cause. Then sometimes there is a cause. The one of there is no cause, that's the one that is idiopathic. It just happens. At birth, they say it was present at birth. Why the other one is, let's just call it a secondary one, acquired one. Maybe from polio or let's say trauma, cerebral palsy, and all that. These are the things that can cause the acquired ones. But the beautiful part of it is that if it's discovered, like if some parents and their own is discovered maybe through ultrasound, because ultrasound can detect it. If it was discovered through ultrasound, the parents will just start preparing for maybe trying out some treatments that are meant for it. Then if it's not discovered and they born the pikin, they see am immediately, the treatment will still go on, because for it to be corrected, it needs to be started early, at the first few weeks or few days of the child's life. Do you understand? You need to start the treatment to know if it can be corrected, because failure to treat it means that the child is permanently deformed for life. You now have to struggle with walking inability and all that. Do you understand? So talipes is either it is unknown or genetic. This is also linked with genetic predisposition. Maybe the parent's mother, the child's mother or the child's father has a talipes. There is likely possibility that their child might have it. That is another distinct factor. There is a school of thought that said male male children are at high risk of having talipes. I don't know how true is that. In as much as we are medical personnel, health personnel, we are not still God. Sure, you understand? But there is a school of thought that said something like that. And most times when you see this talipes, it's always bilateral. It always happen or the eba. Do you understand? It's always bilateral. And the treatment is a casting. They always cast the leg, and it always happen at the ankle. If you watch, only be done at the ankle of the leg like this most times. So they treat the child by casting of the child, depending on how long the person treating the child want the child to be on cast, but it will be constantly changed too and constantly monitored for some signs and symptoms that will indicate danger or indicate doctor's attention. So, but after the whole cast, another step of treatment should be physiotherapy, stretching, exercising. When all these things are done and it's not working, the next solution should be surgery. It's left for the owner of the child or the parents of the child to constantly pray to God to intervene. At least let anyone they try work, even if it's surgery. After the surgery, let it work. So makandi gabi funwa madu sometimes. I know there are some congenital abnormalities, deformities that are caused by improper taking of your prenatal care or improper taking of this or that. We know, but there are some that are idiopathic. Even doctors cannot detect. The only thing is that they will start asking questions, trying to go back to history to trace back the cause, or what could be the cause of such illness, or what could have caused this child to come out this way, or this or that. Just like saying that cleft lip and cleft platelets, that palates, that all of them are caused by lack of. Not all. It's not all the congenital deformities are caused by ọ bụ na mmiri aṅụrụ ọkụ ya mee nji aṅụ my prenatal care na-aṅụ ya nọ ngo nka even nke a na-enye m n'ụlọ ọgwụ adịdị m aṅụ ya nọ nje nnafịa egolu m nnọọ pregnant care ana m aṅụ ya. Yes, it helps, so it helps, but I'm saying that notion mmiri aṅụrụ ọkwa ọgwụ ya ka nwa dị. No, not all of them are caused by lack of aṅụrụ ọgwụ. Some are actually idiopathic. The cause is unknown. Nobody knows. So the way forward is to know the solution. So thank you so much for watching. As you're watching, my pregnant women out there, go to your antenatal constantly, listen to your healthcare provider, adhere to their advice, adhere to all their guidelines. Going to antenatal helps you in so many things, and that will be for my next topic. So, but make sure you listen to your healthcare provider. It is beneficial for you and your growing fetus in utero. Thank you so much and have a nice day. Bye.